Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 535 of our pharmacotherapy series, which majors in anxiety disorders. This case applies to patient PSK in part 534 of this pharmacotherapy series. PSK refuses to continue paroxetine, so escitalopram is prescribed instead. After 1 week of escitalopram therapy at the initial dosage of 5 mg per day, PSK is tolerating the medication well. The plan is to gradually increase escitalopram to 10 mg, then to 20 mg per day during the next several weeks. PSK is also taking alprazolam, 0.5 mg twice daily to thrice daily. What are the desired goals of treatment in this case, and how can PSK's response to treatment be assessed? Five domains in panic disorder have been identified in which treatment outcomes should be assessed. A. Frequency and severity of panic attacks. B. Anticipatory anxiety. C. Phobic avoidance behaviors. D. Overall well-being. And E. Illness-related disability in various areas, such as work, school, and family. The treatment goals in this case are first to stop PSK's panic attacks, then to reduce her anticipatory anxiety, followed by reversal of phobic avoidance. These outcomes should allow her to more comfortably leave her studio when required and, secondarily, improve her overall functioning and quality of life. Several different instruments have been used to assess outcomes of treatment in panic disorder. In addition to the panic diary, others include the fear questionnaire, the panic appraisal inventory, and the panic disorder severity scale. The latter is currently considered by many experts to be the most useful because it evaluates outcomes in all 5 identified target domains of panic disorder. After 3 months of escitalopram therapy, PSK reports she has had no panic attacks in the past month and her functioning has improved dramatically. She is currently taking 20 mg per day of escitalopram and gradually stopped taking the alprazolam 3 to 4 weeks ago. PSK reveals she is painting regularly, selling some of her paintings, paying her rent, and she has begun dating again. PSK is experiencing no significant side effects from escitalopram except for some decrease in her sexual drive. She wonders how long she should continue taking it since she is doing so well. What is the recommended duration of treatment for panic disorder? Long-term medication trials in panic disorder support the recommendation that treatment should continue for at least 6 to 12 months after acute response. The benefits of maintenance pharmacotherapy in preventing relapse are well documented, although the optimal duration of treatment is a subject of continued debate among panic researchers. Maintenance treatment gives patients time to resume normal lifestyles and to re-establish daily activities after acute cessation of panic attacks. In this case, PSK's current escitalopram dosage of 20 mg per day is appropriate because this is within the effective dosage range for panic disorder. Escitalopram therapy should be continued at the current dosage for 3 to 6 more months. PSK's sexual dysfunction is not likely to decrease with continued treatment. Therefore, specific remedies for selective serotonin reuptake inhibitor-induced sexual dysfunction may be tried. After a successful period of full remission, a trial of medication discontinuation may be attempted to determine whether continued treatment is necessary. Medication should not be stopped in patients who are experiencing stressful life events or substantial residual problems in any of the 5 domains: frequency and severity of panic attacks, anticipatory anxiety, phobic avoidance behaviors, overall well-being, and illness-related disability in work, school, and family. When a medication is discontinued, it should be withdrawn gradually over several months, regardless of the class. Because of the devastating impact panic disorder can have, reinstitution of drug treatment is indicated if relapse occurs. Long-term treatment with antidepressants, and benzodiazepines if necessary, is generally successful in maintaining treatment benefits without detrimental effects or dosage escalations. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom, and if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 536.